deep within our homes, a silent killer lurks. It's not the dark alleys of urban nightmares, nor the shadows that hide in every corner of suburban streets. No, it's something far more insidious. In fact, according to a study published in the Journal of Exposure Science and Environmental Epidemiology in 2019, over 90 of Americans have been exposed to a toxic chemical called PFAS in their drinking water. PFAS, short for per and polyfluoroalkyl substances, is a group of chemicals that have been linked to various health issues including cancer, thyroid disease, and reproductive problems. Yet, they are so ubiquitous that it's estimated over 16 million people in the United States alone consume them daily without even realizing it. These invisible assassins can contaminate our water supplies through various means, from industrial waste disposal to agricultural runoff. In some areas, PFAS levels have been found to be as high as 22 parts per billion, exceeding federal health advisories by up to 10 times. The alarming truth is that in the United States alone, over 1,500 public water systems contain PFAS at levels above what's considered safe. But it's not just drinking water. PFAS can also seep into our food chain and other household products we use daily. For instance, non-stick cookware, stain-resistant clothing, and even some firefighting foams contain these toxic chemicals. We wash our clothes with the same substance that pollutes our lakes and rivers. In a disturbing revelation, many of us unknowingly consume PFAS in amounts deemed non-harmful by regulatory agencies, amounts that could still cause significant health issues over time. With so much at stake, it's high time we take responsibility for what we expose ourselves to on a daily basis. But are we even aware of the dangers lurking within our everyday lives? According to a study published in the Journal of Exposure Science and Environmental Epidemiology in 2019, a staggering 91 of Americans have been exposed to a toxic chemical called PFAS in their drinking water. This alarming statistic is just one example of how hidden dangers can infiltrate our daily lives without us even realizing it. PFAS, or per and polyfluoroalkyl substances, are a group of synthetic chemicals that were once widely used in non-stick cookware, food packaging, and firefighting foam. However, research has shown that these chemicals are highly toxic and have been linked to a range of serious health problems, including cancer, reproductive issues, and thyroid disease. In the United States alone, it's estimated that over 16 million people have consumed drinking water contaminated with PFAS levels above the Environmental Protection Agency's non-enforceable health advisory level. This means that nearly 1 in 5 Americans may be unknowingly ingesting these toxic chemicals on a daily basis. The EPA has set a maximum contaminant level for 2 specific types of PFAS, PFOA and PFAS, but many water utilities are still struggling to comply with these standards due to the high cost and complexity of treatment. In fact, a recent report by the Environmental Working Group found that over 200 million Americans live in areas where their drinking water contains levels of PFAS above the EPA advisory level. The widespread contamination of our drinking water is not just limited to PFAS. Other toxic chemicals, such as lead and mercury, are also commonly found in tap water across the country. For example, a recent study by the American Water Works Association (OWA) found that nearly 30 of sampled utilities had detectable levels of lead in their drinking water. The fact is, we have no idea what's really in our drinking water until it's too late. That's why it's essential to stay informed about the hidden dangers lurking in our tap water and demand better from our government and water utilities. As we delve deeper into the world of hidden dangers in our daily lives, it becomes increasingly evident that some people are unknowingly consuming a lethal ingredient every day. A crucial piece of evidence lies in a study published in 2019 by the Journal of Exposure Science and Environmental Epidemiology. The research revealed an alarming statistic. Over 90 of Americans have been exposed to PFAS, or per and polyfluoroalkyl substances, in their drinking water. PFAS is a group of chemicals that were once widely used in non-stick cookware, food packaging, and other consumer products. However, mounting evidence has shown that these substances are toxic and can cause a range of health problems, including cancer, reproductive issues, and immune system disorders. The Environmental Protection Agency (EPA) has identified PFAS as a contaminant of emerging concern. One notable example of PFAS contamination is the city of Newark, New Jersey, where tap water was found to contain high levels of these chemicals in 2017. In response, the state implemented a plan to remove the contaminants from the water supply using specialized treatment systems. However, this is not an isolated incident. PFAS have been detected in drinking water across the United States. A study conducted by the National Cancer Institute estimated that exposure to PFAS through contaminated tap water may increase the risk of certain cancers, such as testicular and kidney cancer. The institute's researchers used data from over 2 million people and found a significant link between PFAS exposure and these health outcomes. The use of PFAS has been phased out in many countries due to concerns over their toxicity. However, contaminated soil and water persist as legacies of the past. The Centers for Disease Control and Prevention estimate that millions of Americans are still drinking water containing PFAS. This widespread contamination highlights the need for more stringent regulations and stricter monitoring of consumer products. The impact of PFAS on human health cannot be overstated. Research has shown that even low levels of exposure can cause significant harm, making it a pressing concern for public health officials. As we continue to explore the world of hidden dangers in our daily lives, it becomes increasingly clear that PFAS contamination is just one example of the many unseen threats lurking beneath the surface. The alarming reality is that PFAS contamination has far-reaching consequences. These toxic chemicals have been linked to various health issues, including cancer, reproductive problems, and immune system damage. The most concerning aspect is that these effects can manifest decades after exposure, making it challenging for individuals to connect the dots between their water consumption and potential health risks. PFAS has become a ubiquitous contaminant in our environment due to its widespread use in non-stick cookware, food packaging, and firefighting foam. The Centers for Disease Control and Prevention have identified over 20 PFAS compounds, with perfluorooctanoic acid being one of the most studied and scrutinized. The 2019 study published in the Journal of Exposure Science and Environmental Epidemiology revealed that 91 of Americans have detectable levels of PFAS in their blood. This staggering statistic underscores the pervasiveness of this toxic chemical in our daily lives. The same study estimated that PFAS exposure may cause an additional 7,000 to 12,000 cancer cases annually. What's particularly disturbing is that some of these contaminated water sources are located in areas with high population density, such as cities and suburbs. For instance, a recent investigation found that at least 18 states have detected PFAS levels above the Environmental Protection Agency (EPA) health advisory threshold. This raises concerns about the potential long-term effects on public health, particularly for vulnerable populations like children and pregnant women. The EPA's own data reveals that PFAS contamination is not limited to drinking water. It can also seep into soil and air through various pathways. In fact, a study published in Environmental Science and Technology estimated that atmospheric deposition of PFAS can account for up to 30% of the total exposure burden.